Over the last 7 years, myself and my colleagues, we've been engaged in physician training where we go generally to other countries and we work with doctors and train them in the biochemistry related to mental health and also show them clinical methods for balancing the body chemistry and the brain chemistry of people with perhaps autism, depression, attention deficit disorder, bipolar disorder, or schizophrenia, and more recently also Alzheimer's disease. And we find that doctors are really interested in learning this. A lot of doctors find that medications are not always successful and can also involve side effects, and would like to have a different way, maybe a more natural way to help these people. And we started this training program in Australia about 7 years ago with a single doctor and worked with 18 patients. And now the last time we've done this, which is just recently here in Australia, in the year 2010, we now are up to, I think we have 31 doctors in training. And I've also done this in Norway, and we're interested in starting programs in 3 other countries in the next 12 months. So I think this is going to be an expanding program, and it's becoming more and more popular because the doctors we've worked with tell us that they love the results they're getting. They're now finding there are patients they could not help before who they now can help. Autistic children who could only receive minor benefits, and now most of these doctors have experienced seeing children become completely recovered, which is not supposed to happen according to mainstream medicine. And to me, there's nothing quite as exciting as seeing a schizophrenic patient become well. It doesn't happen normally in mainstream medicine, but I've now worked with more than 3,600 people diagnosed with schizophrenia, and I've seen hundreds of them become well, and that's so exciting. It's also really exciting to see a violent child become okay, and that's a thrill for the family, and certainly a thrill for us, and it's a thrill for the doctors that learn these techniques, because once they incorporate these methods, the nutrient therapy and the biochemical testing, into their practices, they get hooked, and the reason they get hooked is they see patients getting better, and that's what doctors really are after.